In this video, I will show you a very unusual complication of traumatic brain injury. Here is a skull fracture on the right side of the occipital bone, extended to the condyle through the lambdoid suture. Here is the fracture and extends in this region. In this anatomical site, there are the venous sinuses, the transverse and sigmoid venous sinuses, and the jugular vein and the jugular bulb. Because of the proximity of the skull fracture to the venous sinuses, the clinicians would like to exclude any possible venous sinus thrombosis, so they requested a CT venogram of the head. Here is the CT venogram of the head. We can see that there is very good opacification of the venous sinuses, and at this point there is a filling defect. Compare the right with the left side. Okay, filling defect extending to the jugular vein. Okay, here is the right, here is the left. Some traces of contrast surrounds the thrombus here. Let's go a little up again, and we can see something interesting. There is another filling defect here. Just to remind you that here is the skull fracture at this point. There are some differences between this filling defect and this filling defect. In this case, the filling defect is partial filling defect, and its contour is very smooth. There is narrowing of the venous sinus, and the findings suggest external pressure, and the filling defect is extended to distal superior sagittal sinus. Here is the fracture. Now some comments. I would like to make some comments regarding this finding. First of all, this is an epidural collection, post-traumatic epidural collection, due to the skull fracture causing external pressure to the venous sinuses. And cerebral venous sinus thrombosis is an important but poorly understood cause of morbidity and mortality in traumatic brain injury, with sequelae including venous stroke, seizures, and elevated intracranial pressure. The prevalence is around 4%, and post-traumatic venous sinus thrombosis may be underreported as clinical signs are often non-specific, and computed tomography venography is variably included as part of post-traumatic injury imaging protocols. And several studies have previously identified skull fractures overlying a dural venous sinus as a significant factor for venous sinus injury and thrombosis. Just to remember that despite the high sensitivity of CT venogram of the head for the diagnosis of non-traumatic venous sinus thrombosis, venous sinus compression from hemorrhage or pneumocephalus in trauma patients can confound radiologic diagnosis. Another interesting point is that we have to distinct between thrombosis and external compression, like in this case. In this case, we have both external compression due to this epidural collection and thrombosis. Dear friends, thank you for watching this video. If you like my videos, you can consider to subscribe to my channel so you will notified the next time I will upload a new video to my channel. Thank you again.